So good morning, sir.
Very good morning. So, how the session is going on?
It's very good, sir. Very good, very good.
Great, great, great. Yeah, I have checked your assignment.
Okay,
So, let the other join. So, in the meanwhile, we can talk. So,
okay.
yeah. So, can you please tell me the brief about your topics and all?
My topic, one second, I just, okay, one second. So my topic is, uh, research question is effectiveness of lifestyle modification versus health educational program for improving HbA1c in adults with pre-diabetes in India. Pre-diabetes with in India. I hope no one has did it of this systematic review, sir.
Okay.
So it's a comparison, sir. It's a lifestyle which will be the effective lifestyle modification or health educational program which can be implemented for an Indian context in a primary care setting. So
American.
my
Okay.
yeah, so that is my research question. Okay, research question. So I derived the PICO format according to the research questions. The population I served is more the adults more than 18 years with pre-diabetes in primary care settings. And intervention, lifestyle modification. My comparator is a health educational program. My outcome is reduction in HbA1c. So my primary outcome is to reduction of HbA1c. The secondary outcome is prevention of complication due to the diabetes, prevention of diabetes. So I took it mostly of RCTs, case control and cohort study. So I usually, because this is the newest thing, I hope ADA guidelines, according to the ADA guidelines, it is the newest thing, sir. And I just compare mostly the 5 year strategy, sir. So my strategy, one second, I just searched my strategy yesterday because I was on, had a little bit of flu and all those things, sir. So I just give the concept, keywords, stretch strings. So I found out that around 50,000, 57,513 for the lifestyle and words that are articles in PubMed and health educational program 53,006 5,36,670 HbA1c 17,088 pre-diabetes 27,693 and primary care 4,89,321, sir.
Great.
Yeah. So
Did
I hope
you did Yeah,
sir, yeah.
did you combine everything and did you get the final
Yeah,
one?
finally, it's around some 7 lakh, 8 lakh, something else.
7
In the
lakh 8
PubMed,
lakh.
8 lakh. For me, I was little bit panic because I have to search which is the my
Correct one.
article and all those things. Yeah, yeah. So I hope that in today's class we will get to much about
For
this thing.
clarification.
Good
Correct.
qualification. That's okay.
That's
Thank you,
great.
sir.
That's
Thank you,
welcome,
sir.
welcome.
And sorry for the late submission because little bit of flu and all those things.
No, 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 not at all. Not
Okay.
no issue.
Okay.
Yeah.
Thank you.
So welcome. So yeah. So once again, good morning and a warm welcome to all of you. So we were discussing about the assignment that Dr. has sent to me. Okay. So yeah. So before proceeding, so today, let me tell you one thing. Today we are going to. Uh, am I audible to all of you?
Good morning, sir.
Very good
Yes,
morning.
sir. Yes,
Good
sir.
morning.
Yes, sir.
Great, great. So today we are going to do two things. One, I will tell you what are the things that is required to precise your topic. That is the one thing. I will give you the framework, not only the framework, and we will do it in front. Okay. And the second thing, what we are going to do is that I'm going to give you the Prosperoka whole framework. Okay. Where everything is written, because ultimately,
Hello.
yes, yes.
Yeah, sir, you are not audible, but now you are audible, sir. Yeah, yeah.
Okay, okay. So now what happened? I will give you the Prospero. Okay. So what will happen? So usually it is in the online, okay, the web form. So I have developed it into the Word format. So you just need to go through it and fill it up, because the soon we need to complete it and go for the Prospero registration. So let's start. So before starting the session, so I want everyone, so whether they have any doubts, any clarifications, because first during my session, I want to clarify all the doubts. Yeah. Anyone who is having doubts, any clarification for the assignment that you guys have done? No doubt. No problem. If no one is having doubt, then I have a lot of doubts. I'm going to book a call with you all. Okay. And then we will be having a one-to-one discussion, and there we can have a good one-to-one session and have a discussion. Okay. So no problem. Today only we will be doing one-to-one session also. So yeah, let me start. So what we are going to do today, let me share my screen. Share screen share. Yeah. Yes. So I guess team is also there. Yeah, I would request the team to please send a WhatsApp message as a reminder that we have joined the session and we are live now, because today is important session and some of the people, they haven't yet joined. Just request to the team to please update it in the WhatsApp group. Yeah. So yes. So this is what is the template which is going to help us in understanding how to precise our topic. Because most of the people, they have said, sir, it's become very difficult for us to identify a topic. So this is the template. So this is the template which is been developed by the Kevin and Chadwick in 2005, and this is the template which has been used by most of the international universities. I don't know why in India we don't use this. I don't know. So, so this is how, like, when I was taking the session for the international students and all, we used to use this one. It is their guideline. So by implementing this guideline, it will be very easy for us to understand, and we will be very clear what will be our topic, what will be our objectives and all. So first, just don't like don't make a note or anything. Just have a concentration over here. Let me complete this. Then I will share with you all, not an issue. Then I will explain to you in step by step what to do and how to do. So this is the number one. This is the total 4 templates are there for this, which has been developed. So great. So please go through it and complete the recording so that it will be easy. Okay. So first one is we need to identify the target population. We need to understand what the topic that we have selected. And then we need to identify the target population. Like for example, here, like people, those who are living around the Ranipet Industries area in Tamil Nadu, India, and people irrespective of age, gender, and other factors. So basically, the people who are reside in the Ranipet industrial area is the target population that I am interested for that. Okay. And then I need to provide a rationale that why do I select those population? What is happening to those population? So that means it should have a target population, that is why. This target population in terms of your interest in working with them. That means आप लोग क्यों काम करना चाहते हो, आप इंडस्ट्रियल जो रानीपेट एरिया में क्यों, जैसे डॉक्टर जॉन थे वो बोल रहे थे कि he want to do it for he want to check the HbA1c, right, for the lifestyle modification. Is the lifestyle modification is effective or not? So that's what that means. He is working on the diabetes. Okay, so in that topic it should be very clear why that. That's what we need to write it down. Okay, and some of the things has already been written over here so that it will be a reference for you. And the third step would be coming it out as a identification and analysis of wider determinants of health. So we all understand there are various determinant of health. What are the determinant? Determinant that the factor. So being a healthcare right now, it is evident that it is not only the microorganism or the bacteria or the fungus who is affected or who is the main cause of the disease. Okay, for that medical team is there. Okay, the doctors are there, pathologists are there, everyone is there. They are going to identify कि कहाँ पर कौन सा बैक्टीरिया है, क्या है, and what are the treatment guidelines are already been developed. They have to do it. It is their work. Now, apart from that also, there are a wider determinant of the health. That wider determinant, that means the factor is also there which determine the disease if we are into the healthcare. If not the healthcare, if let's say economics, what are the factor which determine the out-of-pocket expenditure? Everything would be the same. Everything would put into the funnel. So what would happen? So what are those determinants? Like it can be a age, it can be a gender, it can be a behavior, it can be a rural or the urban. For example, as most of you have been reside in the urban area, so you may have you have good access to transport. So if anything had happened, you can directly go to the doctor and ask for it, right, and take the help. What about the person who are residing very far, where the hospital is not there? So they develop the like the coping mechanism. Okay, tomorrow I will go. Okay, after 10 days I will go. Did they really understand what is going on inside their body? Which aggravate. So similarly, a lot of factors are there. Okay, the behavior, psychology, then the perceptions. How do they perceive? No, छोटा सा ही तो चीज है, हो जाएगा. Okay, so whatever. So these all are the determinants. I know you all know about it. Okay, and in that way, you need to draft a section over here. Like I have already written that affect your target population. Example: poverty, education, housing, employment, demographic, etc. Whatever the things. Okay, and then you need to provide the reference, and this reference should be very vitals, and it should not be. I have seen a lot of people, those who are providing the reference from the book, from the newspaper and all. So always please remember one thing. So the book is a good reference, but only one or two book reference is allowed for publication. Okay, and third thing is that if book is there, always quote the book for the definitions, only for the definitions. Okay, not for the concept, not for the interventions. Okay, like is lifestyle modification is helpful in reducing the HbA1c. So here don't quote book. Okay, because writing a book took a lot of time and then publish, so that is outdated, purana cheez hai. So always put a relevant latest article. Latest 2025 चल रहा है, 2025 में if someone has done that type of study, put it over there, cite it. That is the ideal one. And I would like to know how many of you guys do this referencing using a manual or automation kind of thing. Can I have in the chat box? आप लोग ये रेफरेंस कैसे करते हो? मैनुअली करते हो या फिर automation? Your that means the software you are using it, so that I can go here from here only. Never done manually using Jotero. Manual. Jotero. Okay. So most are saying they are doing manually. So great. So from let me complete this first, then I will tell you how you can use the software, different software. Yes, manual, sometimes use Mendeley. Yeah, not sometimes, always use the softwares, both. Always use the softwares. Okay, great. So after the session, we will be going through that. So uh, let me tell you, is this the first step is clear to all of you? Is it easy or is there any confusion? The HNA process. First, the population. See, the whole template will tell you what would be your title of the study. See, nowhere is the title. Okay. पहले आप पॉपुलेशन बताओ, फिर बताओ उसका रैशनल क्या है, फिर बताओ आप उसमें फैक्टर्स क्या क्या अफेक्ट करते हैं. दैट्स इट. विद दिस यू विल बी एबल टू कंप्लीट योर फर्स्ट टेम्पलेट ऑफ वर्क. ओके. सो आफ्टर दिस you need to go to the second template which will help you in understanding more precisely about your study. So again, we did the target population, right? Then you need to choose the one problem that they are facing. They may face a lot of problem. That group, when I say they, that means the group of the people that you have selected. Like they may have a obesity related. If obesity, then again obesity related, a lot of disease, a lot of problems would be there. Malnutrition, malaria, a lot of things would be there, right? So you need to pick the one, only the one you need to pick. Okay. And then you need to talk about the size. So what does the size means? So that means like for example, that means you need to talk about the prevalence. So what was the prevalence of the particular, like for example, if you have select the malaria over here, then you need to tell about what is the size, like how many people in that particular, let's say if it is in New Delhi. So in New Delhi area, what was the prevalence? In India, what was the prevalence? Or in the North India, what was the prevalence? Okay, that kind of thing you need to draft or you need to write it down, just 4 to 5 lines, that's it. And then you need to talk about the severity. Once we say the severity, that means how badly they are affected. That means like if it is diabetes, so you need to read the article like कितने लोग diabetes की वजह से they got a gangrene. Because of that, they need to get a amputee of either their hand, leg, thumb, or the toes, whatever it is. That kind of thing, severity. How many of people are there, those who are unaware about of it, and because of that, that will be having a risk of developing some other complications. That's what you need to write in the severity. Okay, let me draft it. Okay, write it down for the easy way. So when I say about the size, please please talk about the prevalence, okay, in that region. Then country, then country. Okay, like that. Don't go beyond that, just stick to the country. And if it is a severity, talk about the risk factor. Okay, talk about the risk factor. This is the thing you need to talk about. Okay. And then we need to understand, is there an existing effective and acceptable intervention is there? Okay, is the intervention is there for that or not? Okay. And then if intervention is there, then which population are involved into it? And once that is there, what is the priority of the government, local government as well as the national? What is the priority? Are they doing that? Is there any program? Is there any intervention that has been initiated by the government of India? If it is India, if it is other country, whatever. And then you need to because right now you understand what is the population, कौन सा population है, उस population में problem क्या क्या है, उस problem में क्या क्या other determinant हैं, उस determinant के साथ और क्या severity है, उनका size क्या है, क्या क्या इंटरवेंशन ऑलरेडी है जो गवर्नमेंट ऑफ इंडिया कर रही है या जो भी है, इधर लोकल गवर्नमेंट या गवर्नमेंट ऑफ इंडिया, और उसमें क्या एक्टिविटीज, क्या इंटरवेंशन हो रही और क्या नहीं हो रही है. That's everything idea you all are having right now. Now, based on that, you need to propose a new intervention for that population. Okay? So, like for example, यहाँ पे दिया हुआ है like 2-hour health education session for a mean age group of 40 to 45 years in Northampton. ओके ये लाइक उनके लिए हम लोगों ने ड्राफ्ट किया था तो इसलिए उनका नाम लिख दिया है, आप यहाँ पर लिख सकते हो इन इंडिया, राइट, लाइक दिस, इन इंडिया. ओके, लाइक हियर वी हैव ड्राफ्टेड. यहाँ पर भी कुछ गलतियां आएंगी, बस ट्राई टू आइडेंटिफाई. दिस इज द वन ऑफ द असाइनमेंट डन बाय वन ऑफ द स्टूडेंट. ओके, so कुछ problems हैं, but the main purpose is that you will get the idea what to draft. That's why I'm sharing with you. Like here, health camp and other health checkup initiative, policy recommendation, then remove waste and hazardous item from the environment and make environment clean, will ensure the supply of something. Okay, so इस तरीके से you need to propose a new intervention, and then again definitely with the citations. Okay, so this is the two document which is going to help you in understanding आपको क्या टॉपिक लेना है. अगर आप क्या टॉपिक ले रहे हो तो उस टॉपिक में क्या लिखना है, what you need to write it down, and how you are going to precise your topic from the from the broader topic to the narrow down. This is how. And if you follow this two template, and everything would be done for you. Just you need to fill, just like a fill in the blanks, the how we are doing when we are kid. But that was at that level, right? So this is, I would say, adult level fill in the blanks. So this is the blank like this, right? You need to fill. That's what. Yeah. So yeah, how, so any comment on this? Is it useful for you?
Yes, sir.
Useful?
Yes, sir. Yes, sir.
Yes.
Perfect. Because some of you are asking me like, sir, हम लोग कैसे करेंगे, क्या होगा, टॉपिक समझ में नहीं आता है कि टॉपिक क्या लेंगे, what would be the topics, right?
सर एक्चुअली मुझे भी ये डाउट था कि लास्ट टाइम मैंने जो असाइनमेंट कंप्लीट किया तो मैंने टॉपिक चूज किया, पर उसको कैसे ड्राफ्ट करना है, कैसे लाइक ये ठीक है कि नहीं, ये सब कुछ डाउट थे ये सब.
एग्जैक्टली तो अगर आप ये टेम्पलेट ले लोगे, इस टेम्पलेट में पहले डाल दोगे, सी टोटल
जी
4 टेम्पलेट्स आर देयर, बट सिस्टमैटिक रिव्यू के लिए ये 2 इज काफी. सो दिस 2 विल हेल्प यू इन अंडरस्टैंडिंग कि आपका टॉपिक किस तरह से ब्रॉडर टॉपिक से, क्योंकि सी हमारा टॉपिक ऐसा होता है, मैं मलेरिया में करना चाहता हूँ, मैं डायबिटीज में करना चाहता हूँ, है ना, मैं ओबेसिटी
जी
में करना चाहता हूँ. दिस वुड बी द ब्रॉड टॉपिक. So how we can narrow from broader to the narrow using this template. Okay, very effective template, very, very effective templates. Okay, I will give you all the, I will later on, I will give you the other 2 templates. Okay, for your purpose, and right now I will give you the 2 templates. Okay, so
okay, sir.
once this is done, it is clear can I move to Jotero so that I can tell you how you can use the Jotero for those who are doing manually or those who are unaware about the Jotero?
Okay, sir.
Okay. Yeah. So first of all, you can go to browser and type Jotero. Simple. Like this. Okay. And download it. From here, as per your laptop configuration. Okay, so you can download it from here. If it is iOS, if it is Linux, if it is Windows, Mac, or Android, whatsoever it is. Okay, download as per your requirement and go for the installation. You all know how to install it, right? Once you guys install it, then it will be coming to your, yeah, because you already have provided the email ID, password, and it will be linked. And once again, if you click over here, it will prompt you for the ID and password. That is that ID and password that you have created for the Jotero. Okay, not your email ID. Jotero में आपने जोन सा किया है वही वाला आ जाएगा. Okay, so this is how it look likes. Okay. Now the next step is that we need to integrate this with our Word. Okay, let's say, let me show it to you. Yeah, so this is how it will be coming. And see, those who are having the Mendeley would be coming over here as I have a Jotero installed. So Jotero is coming here. Now how to do this? It's very easy. You need to come to over here, go to the tools, go to the plugins. Okay, as I already have all those, I have already used it. So here it will be pop up like the Word ka plugins. You just need to click over here, and before doing that, you need to close all your Word files and everything. Okay, and then once it get installed the plugin, automatically it will. How do you know that whether it get installed in your Word or not, or linked? So you should get this one, the Jotero. Okay. And if no, if again you are facing any difficulty, go and type in the YouTube how to install it and how to link it. A small video would be coming and you can go for that. Okay. So what is the use of it? Let me tell you. For example, like you have draft a content, like you are saying that in India, the prevalence of diabetes is 34%. However, in many places like Bhubaneswar, Kolkata, Chennai, so it was from 30 to 65%, something like that. Okay, आपने ऐसा कुछ लिखा है एंड आप यहाँ पर साइट करना चाहते हो क्या, एक आर्टिकल, कौन सा आर्टिकल? सो आपने ये लिखा हुआ है तो आप ऑब्वियसली प्रिवेलेंस देखना चाहते हो, तो आप क्या करते हो, यहाँ पर आते हो और लिखते हो प्रिवेलेंस ऑफ जो भी है, इससे पहले का है, राइट? एंड आप एक आर्टिकल सिलेक्ट करते हो, like this, जो मैंने लिखा वो बाद में आता है, पहले आप यहाँ पे पढ़ते हो, आप आर्टिकल एक देखते हो, उसके हिसाब से आप लिखते हो। सो आपने देखा यहाँ पर जैसा है, द बर्डन ऑफ डायबिटीज इज इतना, लेट्स से आपने इसी को ही रिपोर्ट किया है। ओके, दिस इज व्हाट यू हैव, ऑब्वियसली आई एम डूइंग द कॉपी पेस्ट, यू आर नॉट सपोज टू डू दैट। आपको यहाँ पर अपने लैंग्वेज में लिखना है, यू नीड टू राइट इट, राइट ऑन योर ओन लैंग्वेज, और एल्स प्लेगरिज्म आ जाएगा, राइट। सो दिस इज व्हाट वी नीड टू डू इट। सो राइट नाउ आई वांट टू साइट दिस, मैं बताना चाहता हूं कि मैंने कहां से लिया, दैट्स व्हाट इज कॉल्ड एज citation. Now always remember the citation are of different types, only two types. Okay, number one citation you must have seen, like the numbers are coming, right? So उसमें numbers आ जाते हैं like this, right? And somewhere you may have seen ऐसा ही होता है, brackets आ जाते हैं, okay, like this, brackets would be coming like this, you must have seen. or somewhere else वहां पर क्या होता है, नाम लिखा रहता है, like for example Panda et al full stop 2025, something like this, right? तो ये ब्रैकेट में होता है, right? Like this. Okay, so here it is of two type, one is the number, one is of this type. And then आपने देखा होगा किसी में एटॉल आएगा, किसी में दो ऑथर आएगा, किसी में थ्री आएगा, किसी में टाइटल्स भी रहेगा, दैट ऑल डिपेंड ऑन द आपका स्टाइल के ऊपर, विच स्टाइल डज योर इंस्टीट्यूशन और द पर्स और जर्नल दे डिमांड इट। हाँ, सब जर्नल का सबका रिक्वायरमेंट अलग है। ओके, लाइक एक यूनिवर्सिटी से यूनिवर्सिटी अलग रहता है, वो किस स्टाइल में चाहते हैं। लॉट ऑफ स्टाइल्स आर देयर, ओके, लॉट ऑफ स्टाइल्स। अमेरिकन, दैट्स वी कॉल्ड इट एज द एपीए स्टाइल, जिसमें आपका I will show you how it comes. Okay, word type के आएंगे, that is called APA style. And if you want the number kind of thing, it will be coming as a Vancouver style. Okay, the number. And more style if you want to, कोई वहां पर नहीं है, you can come over here. Okay, and go to the additional style. And here you can click over here and identify. आप suppose एक जर्नल में डालना चाहते हो, that journal want a specific style only, search over here and then click it. See, so many styles, thousand styles are there, right? So आप कहां पर कौन सा स्टाइल डालना चाहते हो, which is recommended, it is not based on your wish. Okay, it is based on the पर्सन जहां पर हम रिपोर्ट दे रहे हैं, आई वुड से थर्ड पार्टी, बेस्ड ऑन द थर्ड पार्टी रिक्वायरमेंट वी नीड टू सिलेक्ट इट, नॉट as our wish. However, the standard is the APA and Vancouver style. Okay, so let me show you how does it look like. Okay, so अभी के लिए मैं इसको omit कर देता हूं. What you need to do, जैसा कि ये आर्टिकल हम लोग साइट करना चाहते हैं, राइट? दिस आर्टिकल आई वांट टू साइट इट, व्हाट आई वुड डू, आई विल look for the DOI number, this DOI number, okay, and I will simple click over here and do the right click and copy the link address like this. और फिर मैं क्या करूंगा, जोटेरो में आ जाऊंगा and here I will be create one folder. Okay, this one I can say trial, so that it will help me in understanding कि कहां पे कौन से फोल्डर में मेरे आर्टिकल्स हैं, and then I can do a lot of thing, I will tell you. फिर आप यहां पर आओ और वो ही DOI को एंट्री कर दो. Once you enter it, all the relevant information will get imported. Okay, everything. Pradeepa and ये Pradeepa Rajendra, right? Yes. So the same article, right? So epidemiology of type 2 diabetes in India. So here it is, epidemiology of type 2 diabetes in India, same. Okay. So now I need to cite it. How I can do? I can simply come over here, give a one space, go to the Jotero, click over here. Which style I want, it is asking. Let's go for a Vancouver right now. So this is the new feature. मैंने जोन सा भी article दिया होगा, it will be come over here. And I can select and then click over here. See, boom, automatically came. Okay. So this is how we need to do it. And what if it is not there, like हमें पता नहीं है वो कौन सा है, I want to look for other. So आप क्या करोगे, आप यहाँ पे जाओगे, क्लासिक व्यू कर सकते हो, जो भी आपने डाला होगा, it will be like for example यहाँ पर see a lot many are there. See, मैंने डाला हुआ है इसलिए है, बट यहाँ पर एक ही डाला है तो नहीं है यहाँ पर. ओके. So already आ जाएगा. The moment it come, I can select it and click over here, it will be pop up. And how easy it is. So at the end जब आपका काम हो जाता है, at the end आप एक reference डालते हो, right? आप एक chapter बनाते हो, that is called reference. At the end आपको अपना काम करना है, right? At the end you create a reference like ऐसा, आप यहाँ पर, that is called as bibliography, आप डाल दोगे. See, it comes automatically. Now आपने जब डाला तो they said that third party, no, what you did is in a Vancouver style, I wanted it in a Harvard style, or I want it in a APA style, the word wise written. You don't need to do manually kind of thing, just come over here and instead of the Vancouver, what the style you want. So this is the APA 7th edition is the standard one. Okay, gold standard. Most of the people, they require this. So click over here, do the refresh. See, Pradeepa and Mohan 2021, it came automatically. And here also it get converted. See, you can see one, because that is the style. It is not supposed, because यहाँ पे जो style होता है इसमें alphabetical order में आ जाता है, not with the 1 2 3 4 kind of thing. So the numbering has been removed automatically from here. Yeah, over to you guys. Is it clear?
Yes, sir.
Great. Any doubt, any clarification? Great, great. Perfect. So please, from the next time, okay, do it in the Jotero, क्योंकि बहुत बार प्रॉब्लम आती है and we get a lot of stress, उसको change करना पड़ता है. Like हम लोगों को APA numbering system से, फिर हम लोगों को like the word that we called it as the APA style, or sometimes they wanted it in the like number system 1 2 3 4, that we call it as a Vancouver style. Okay, so that is the good. Use the Jotero. In one click, we can do it and we can save a lot of time. That's what. Clear? Perfect. Perfect. Great. So today I want you, all of you, to please download it. Okay, download it, link it. It is not so difficult. It is very easy. And it will definitely solve a lot of problem, all of yours, and you are going to save a lot of times. Okay, yeah. So next, अभी हम लोग जाएंगे, आपको let me show to you. Yeah, this we did it. So here is your Prospero registration form. Okay, this is what is the registration form. सबसे पहले जब भी हम कोई सिस्टमेटिक रिव्यू लिखते हैं या स्टार्ट करते हैं, वी नीड टू फर्स्ट रजिस्टर इट. ओके, सो रजिस्टर करने के लिए दिस इज द इंफॉर्मेशन इज रिक्वायर्ड. Very basics information, all the example. This is not something what I have uh, created for you. This is from the Prospero itself. Okay, so here like the review title. So एक title में क्या होना चाहिए, example is written. Okay, what criteria that it should have. Okay, and then language, what language, if you are going to write it in Hindi, Telugu, Malayalam, no problem. Right now it's everything, all the language has been accepted. Then the start date, everything is written over here. What I want
Excuse me,
from
sir. Can you share the screen, sir?
oh, I forgot. Yeah, this one. Okay, so here is the Prospero ka full document. Okay, so everything is written over here, the review title. What I want from all of you is that कि आप लोग इसको रखो as it is, रखो, don't delete it, and from here at the bottom, once you understand this, then draft your title. Okay, similarly go ahead in this way, what you understand. This is the today's task and you guys need to do it right away. Okay, and then in the meanwhile, what I am going to do is that yeah, I'm stop sharing. Yeah, so after this, this is 10:35, this is the 10:35. I want to discuss with you one by one. Okay, so to do that, let me share you with my time schedule. Just give me 1 minute time. Okay, let me create it for you. Give me 1 minute time. Yeah. If anyone is having any doubt, any clarification, they can ask me right now. Yeah, any doubt? Hmm? No doubt. कोई बात नहीं. Yeah. So, okay. Wait a second. Yes, almost done. It's SRMA 1 session. Okay, 1 to 1. Where Zoom call. Okay. Here, Zoom link. Sir, Control C. Yeah.
Sir, do we start filling that Prospero form now?
Yes, like before that, you should complete your proposal. So I'm sending you this template. So you start filling the template. Yes. Wait a second. Joom link. Let me set the link. Yes. Yeah, done. Copy link. Yeah. So I want everyone for today's session only, you booked the time. Okay. And come in that way. Yeah. So here is the link. Check the link. Okay. This is the link. And you start booking a slot for today's only. Okay. Don't choose like it will be asking you go for other dates, but select today's only. Okay. 15 minute, whatever the slot is available from now, you can book it. Okay. And let me share this in your WhatsApp group. Okay. So I'm sharing all the materials, whatever we have discussed today, in the WhatsApp group. Yeah. So this is what I have shared. Please confirm if you have received the material. And I'm sharing the Word file. Okay. Yeah. It's done. Just confirm. Okay. Perfect. Great. So got it. Perfect. So what would happen? Let me just brief you. Just today only, you just book 1-to-1, so that where we will be discussing with you personally, and try to understand what is your topic, where did you stuck and all. Okay. So from there we can proceed. And regarding the two template which I have shared to you, which is going to clarify you on your topic. Okay, on your topic. आपका टॉपिक क्या है, क्या होना चाहिए, उसमें क्लैरिफाई आएगी. And once that is done, then we need to proceed for our another thing, that is the Prospero. That is the next step. Okay. So the Prospero is what? Prospero में हमें अपना प्रोटोकॉल डालना है. So that means we need to draft a protocol first. Okay. And don't worry, अगर वो 50% 60% भी अगर okay है, no problem, because the draft that we are going to publish it, we can do the edit also. Okay, we can do that. Don't worry about that. So I want all of you in like today is a Sunday, please work on it, or by tomorrow in 1 or 2 days, I want all of you to prepare your protocol and submit it to the Prospero. Is it clear? Perfect. So start booking the time, and let me check who is the first one so that I can meet and discuss. So great. Great. Please book it. Please book it right now, the time. और सिर्फ आज ही के डेट का book करना, please. Others have not available, even though it is showing others commitments are there. Okay. Could you repeat, sir? Okay, I am saying I have shared a link. I have shared a link of a one-to-one meeting. This one. And you guys need to click over here and book a slot of mine, and then we can discuss about your topic and finalize it. And along with that, I have shared 3 documents. 2 Word documents, that is a template which is going to help you in clarifying your topic and basically narrow down it. And the another one I have shared, that is the Prospero registration. Okay, so that is a protocol. So we need to draft the protocol, and everything we are going to discuss in one-to-one. Okay, and after that you are going to work on your proposal and you are submitted to the Prospero. Okay. So you guys need to, at least by the next class, you guys need to create a Prospero account, and those who can submit it, you can submit it. And if you guys face any challenge, we can again discuss it. Clear?
Yes, sir.
Perfect. Yeah. Yeah. How many of you have booked the slot right now? From next Sunday, this will be one. No. Amrita, where are you? Not from this next Sunday. Right now, you need to book this Sunday. For today's 24/8/2025. For today's only, you need to book a slot, not other day.
Sir, I have booked a slot by 7:30 to 7:45 p.m.
7:30 to 7:45. Okay. Booked it as per your requirement. We will discuss. Okay. Whatever the time slot which is fit to you, and please be available on that time. Okay, because I am giving you my time and I can understand, like, we all are busy, right? So you choose of your own, and don't the system I have built, it is going to give you the reminders of it. So did you, if those who have booked, did you all receive the email for the confirmation also? Yes,
Yes, sir.
perfect. You all will be getting the reminders too from my side. Okay, so don't worry about that. So please be available. Anyone who has booked the slot of right now or after 10 or 15 minutes? I mean 11 o'clock. Anyone who has booked? No, I will check. Okay. Booked 6:30. Okay, that's great. Everyone has booked. Amrita, have you booked the slot? Mehak, have you booked the slot?
Sir, it
Excuse
is
me,
not
sir.
allowed to book for today.
Book for today. All the slot have been booked.
Yes, sir. Seems like it.
Seems like it. How? It's not possible.
Sir, in my system, it's not showing the option to select today.
Okay, so if not, then you be here. Okay, I will discuss with you. And sir has also discussed with me regarding your topic. We will discuss. Be here online. Okay, so your
Okay,
session will be around 11 a.m. Okay,
Okay,
great.
sir.
So yeah, anyone else like Mehak who is unable to book?
Sir, I am also not able to book, sir. And moreover, I am not in station, sir. I am in Calcutta right now. I have a travel time of 2 hours in car, and then I have to take flight to Guwahati, sir. I've come to AIMS
At what time you
Kalyani
will
for
be
some
available?
discussion.
At what time you will be
Sir,
available?
matlab, I am just for this class. I'm just sitting in the guest house, sir. With due respect,
Okay.
then I'll just my car has come. Then I'll travel, and sir, with due respect, if tomorrow, if possible, sir, because 7-8 o'clock is my flight. So then traveling in car, it's 2 hours from AIMS Kalyani to Dum Airport, sir.
Okay. Do one thing, then you book a slot of tomorrow after 3 p.m. Okay.
Right, sir. Right, sir. That will do,
After
sir.
3
Thank you so
p.m.
much.
you booked it. Okay.
Right,
Yeah.
sir. Right, sir. Thank
Okay.
you, sir.
Perfect. Anyone else who is like this, who is unable to, because I want everyone, I want to talk to everyone. Okay. So please
Yes,
book it. Anyone? Uh,
sir,
yeah, Krishna's. Yeah,
sir, I have a request.
please.
Sir, actually, in my area, there is heavy rain going on and there is a electricity shortage.
Okay.
I'm having problem in connecting, sir, today. That's why I was also late. Sir, if it is possible, can I have a slot for tomorrow?
Tomorrow, not today.
Yes, sir.
Okay. Then that's what after 3 only you booked. If Krishna's has booked 3, then what is the next slot? Don't book beyond that. Okay. 3 to 5 tomorrow only.
Thank you,
I
sir.
haven't
Thank you so
mentioned
much.
in that calendar. Okay. So 3 to 5 you booked it tomorrow. Yeah.
Thank you, sir. Thank you so
Great.
much.
Anyone else?
Excuse me, sir. I am unable to book, sir.
You two are unable to book for today's session. Like then be here. We will be discuss right now at 11. Okay.
Okay, sir.
Yeah. Perfect. So okay. So ma'am, you are Shashmita, right?
Yes, sir.
Okay, ma'am. So yeah. Perfect. So Sashmita ma'am, please be here and rest. You can leave the session. That's all for today's. What I want, so those who have booked for tomorrow or late session, till now our session time is there 12. I would request, please don't do other activity as you have committed to the systematic review. Give time to your own systematic review. I want you next 1 hour look into the 2 documents that I have shared to you, try to fill it down, and looked into the like the document for the Prospero. What are the things that we need to fill it up? Try to read it once, so that if tomorrow we are, or the late evening we are meeting, so you have something, you have a lot of doubt to ask me. Okay. Sir, will I book for tomorrow? Who is this? Yes, Amrita, you can book it for tomorrow. Okay. So this is Amrita, right? Yeah. You can book it tomorrow, but 3 to 5 p.m., not beyond that. Okay. Yeah. So all sorted, right? Perfect. So I request everyone to please log out except Shashmita.
Thank you, sir.
Welcome.
Sir, with due respect, I wanted to ask, so we'll be discussing one-to-one on the topic and the template
Yes.
which you have sent. We have to, because now we have 1 day time, so we have to design with the template, the research question again, which you have shared, and try to discuss the previous session, which you have told to add the tables and all. We'll be discussing that only, na, sir?
Yes. Yes. Yes.
Right, sir. Right.
Everything. Tomorrow we will be discussing. So
Right.
try to get the time, whatever. I want you do whatever is possible. Okay.
Right, sir. Right, sir. Right, sir.
Something, whatever is possible.
Right.
Okay.
Thank you so much, sir. Thank you so much.
Perfect. Yeah. So please log out except Shashmita. If anyone want to be here, Shashmita ma'am, do you have any problem if others would be there?
No, sir. No, sir. No problem.
No problem. Okay. So it is up to you. If you guys, anyone who want to be here, no problem at all. And if you want to leave, you can leave. No problem. Yeah. Over to you, Shashmita ma'am. Can you please switch on your camera?
Yes, sir. Road meter.
Yes.
Sir,
कौन तुम्हें?
actually, yes, sir. Sir, actually, I'm the starting.
Okay.
So I don't know about the systematic review, how to do.
Okay.
I'm formulating a problem. That
Okay.
is the effectiveness of the oromotor stimulation in promoting oral feeding. That is
Okay.
effectiveness of oromotor stimulation
Hmm.
in
Hmm.
improving feeding performance of preterm infant.
Okay. You have submitted the assignment also, right?
Yes, sir. Yes, sir.
Check that one also. Here you have submitted the assignment. Shashmit. No, yours is, yeah, you asked me, na, it was you haven't uploaded. You create the folder, but it seems like I have read your topic. I think this one. Oh, you put a, okay, you write it down and put it right. So it is the effectiveness
Okay.
of the oromotor stimulation in promoting the oral feeding. What it is,
Yes.
oral feeding?
Skill.
Oral feeding, feel.
Skill, sir. Skill. SKIL. S for
Scale. Perfect. So effectiveness of oromotor stimulation in promoting oral feeding scale. So that's great. So here, first of all, effectiveness of oromotor stimulation in promoting oral feeding scale. So if you're talking about the scale, then who should have this scale? Who is going, that means who is going to perform? कौन करेगा?
sir. Staff nurses will be
Staff.
do the
Is it the one only the staff nurse only will do, or कोई others भी कर
or
सकता है?
mothers also. Yes, others also can do. Mothers, fathers, or those are
Everyone can
close to
do.
the
Exactly.
everyone.
तो आप बता सकते हो, so that हम, अच्छा, तो अभी आप ये तय करो, you need to figure it out कि what you are going to propose. Are you going to see, because see, obviously if it is a staff nurse, they are the skilled person, right?
Yes.
They are the skilled. And if you are going to teach to the people, they are unskilled person, right? You're teaching
Yes.
them. So you need to, again, this is again the two group. So आप क्या ये स्टाफ नर्स में देखना चाहते हो या अदर्स ग्रुप में भी देखना चाहते हो? Figure it out.
In others groups. Yes,
In
sir.
other group. So
Other
in,
groups, that is.
perfect, in other group. So in other group, we can say it as a caretaker.
No, sir. Parents first, mother only. I am giving priority to the mother.
Mother. So mother. So we can say that you can like your research question would be in such a way like, is the effectiveness of the oromotor stimulation by mother? Only the mother would be giving, right? Then who else? Yeah, only the mothers. So you can say, is the effectiveness of oromotor stimulation by mother is improving the oral feeding?
Yes, sir.
Got it?
Yes, sir.
समझ में आया? सो हमें यहाँ पर क्यों, क्योंकि हमें बताना पड़ेगा. सपोज फॉर एग्जाम्पल, ठीक है, मदर है, व्हाट अबाउट लाइक कोई कोई केस में जिसकी लाइक प्रॉब्लम होगा, अगर किसी का नहीं है ना, कोई डेथ हो गया, क्या हो गया, देन
Yes, sir.
ऑब्वियसली फॉर द केयर टेकर, राइट, वी नीड टू थिंक इन दैट
Yes,
वे
sir.
ऑल्सो. ओके, सो अल्टीमेटली आप जब हम लिखेंगे इसको स्टडी में, वी नीड टू डिफाइन इन दैट वे. बट अभी के लिए आप मदर कर दो. ओके, सो
Okay.
योर टॉपिक इज वेरी प्रिसाइज. आप देखना चाहते हो नाउ. यहाँ पर और एक चीज आ गया आपके लिए. आप जो ये ओरोमोटर स्टिमुलेशन करोगे, ओरोमोटर स्टिमुलेशन अगेन आर ऑफ डिफरेंट टाइप्स, करेक्ट?
Yes, sir.
So you need to again clarify which oromotor stimulation you are going to do it.
Okay. Types, sir.
Types, oromotor stimulation types.
Okay.
Is it with the finger? Is it with the different probes which is available?
Yes, sir.
Or there are 4 or 5 different oromotor stimulation? Because आपका स्टडी है इफेक्टिवनेस, राइट? सो दैट मीन्स आप
Yes.
कंपेयर करना चाहते हो, क्या ए अच्छा है या बी अच्छा है, राइट?
Okay, sir. Yes, sir.
इजंट इट? आप करना चाहते हो क्या ए अच्छा? आप मतलब क्या देखना चाहते हो, वो ए या
मैं
बी कौन
देखना
सा
चाह
अच्छा है? हम्म
Then nobody else knows about the oromotor stimulation. That should be baby should be not getting the feeding properly. So that I want to know the mothers or anyway. Anyone should give the types, means which types I will provide that the finger will be, I want finger will be not sterile properly if I will give the other people. So that any other process if I will give her not confirm, sir.
That's what. Yes.
I want to
So
know,
that's what you need to.
sir, I want to know the all the babies should get the breastfeeding. That is my motto.
Correct.
And
Hmm.
so that I am choosing this topic for how to do it.
That's
I am not.
perfect.
I
That's
have.
perfect. No. That's what we are. I'm guiding you like what should be, right? So as your topic is that the effectiveness. So जब हम अपना topic effectiveness डाल रहे हैं ना, okay? So that means we are going to compare the things, okay? So मैं आपसे समझ रहा हूँ. तो आप क्या चाहते हो? आप ये चाहते हो कि अपने स्टडी में देखना कि जो हम ओरोमोटर स्टिमुलेशन जो हम लोग दे रहे हैं, is it effective or not, right?
Yes, sir.
Yes. So oromotor stimulation जो है, so these again are of different types also. Okay. So
Okay.
आप क्या
Yes,
कर
sir.
सकते हो? आप you can go and do for the review of literature. Then you will understand कि कौन सा दे रहे हैं. Okay. And from there
Okay.
आप डिसाइड कर सकते हो कि कौन सा अच्छा है, बिकॉज यू आर द मेन पर्सन, यू कैन अंडरस्टैंड विच वन इज इफेक्टिव, राइट? एंड देन यू कैन रेज अ क्वेश्चन, अच्छा क्या ये और ये इन दोनों में से कौन सा अच्छा है?
Yes, sir.
Got it? And you need to keep only 2 things. Okay? So like for example, मैं आपको बता देता हूँ. Let's say for example, one oromotor stimulation finger and another one through the different probes. Market में बहुत सारे probes भी हैं. Okay? So
Yes.
let's say market probes. So हम ये देखना चाहते हैं आपके स्टडी में, क्या हम फिंगर से स्टिमुलेशन करने से अच्छा होता है या कोई प्रोब यूज करने से अच्छा होता है? हाँ? And then based on that, as
Okay,
it is a systematic review, we need to look for the article in that way. वही आर्टिकल
Okay.
देखेंगे हम. Is it clear?
Yes, sir. Yes, sir. Yes, sir.
Perfect. तो आप इसी चीज के ऊपर अभी do more review of literature and figure it out कि क्या है, and आप that means you have to be very precise. Okay? जो मैंने अभी आपको 2 डॉक्यूमेंट दिया है 1 and 2 जो व्हाट्सएप ग्रुप में गया है, चेक दैट ग्रुप, एंड उस 2 को अगर आप फिलअप कर दोगे, आपका क्लैरिटी क्लियर हो जाएगा. हाँ, मे बी आप अगेन इसको और भी क्लैरिटी कर सकते हो. कौन से पॉपुलेशन में? यंग मदर्स जो लाइक 15 to 21 22 जो है, यंग मदर्स वाले ज्यादा अच्छी तरीके से कर पा रहे हैं.
Yes, sir. Primary mother. I am choosing those are the primary mothers. I want to take them. The first pregnant, those, and also I am doing in the
first
NICU,
pregnant.
preterm infant. Yes.
इन NICU में आप करना चाहते हो, दैट्स ग्रेट. ग्रेट, आप कर सकते हो.
NICU, preterm infant.
प्रीटर्म इन्फेंट, परफेक्ट. ओके, प्रीटर्म में आप करना चाहते हो, दैट इज अगेन वेरी स्पेसिफिक, राइट? सो दैट्स परफेक्ट. तो आप यही चीज को, वो जो 2 डॉक्यूमेंट मैंने दिया है आपको, उस 2 डॉक्यूमेंट में ट्राई फिलिंग दिस कंटेंट. ओके और वहां पे ऑलरेडी
Okay.
लिखा हुआ है दैट इज नॉट 100% करेक्ट ऑल्सो, जस्ट आपके गाइडेंस के लिए, ओके। एंड द थिंक वट एवर यू थिंक इज करेक्ट, ड्राफ्ट एज पर दैट ओनली।
Okay. Sure.
क्लियर?
So kindly guide me, sir. I want to do the systematic review, but I have no idea. So that
That's
I will.
why we are providing the training. Okay, that's why we are providing the no training, no problem. You just do one thing. आप क्वेश्चन पूछो, ask your doubt. जहाँ पे भी आप अटक जा रहे हो, you ask the doubts. Okay, okay. Is it clear? आपको clear है
Okay.
ये चीज?
Thank you.
Perfect, perfect.
Yes,
Complete
sir.
that
Clear
task
when
and
I will
Prospero
fill
जो भी
that form, I will.
please do
Yes,
that.
sir.
Okay, try to do that. Yeah.
Sir, I will.
So yeah, you can log out.
Thank you, sir.
Sure, sure. Great. Thank you. Anyone और कोई है? Rashmi, are you there?
Yes, sir. Good morning, sir.
Good morning. आपके साथ कर सकते हैं 1-to-1 session अभी?
Sir, I have scheduled it for 7 p.m., sir. Let me do that form you have shared with me, and I will go with the 7 p.m., sir.
7 PM में आप जाओगे? Okay, perfect, perfect. तो अभी
Yes, sir.
आपने सुना what we had talked right with Shashmita, है ना? तो
Yes,
आप
sir.
भी
Yes,
अपना उसको prepare कर लो so that very
yes, sir.
useful हो and we can proceed. Okay, that's great.
Yes, sir.
चलो फिर.
Thank you, sir.
Okay, yeah, great. So Santosh is there. Santosh, are you there? No. Perfect. So that's it for today's session. So this side, Dr. Paramjot Panda, log off right now and we will meet you on your sessions. Thank you. Have a nice day.